Hello and welcome to Hikigai Podcast, where data meets decision and innovation shapes the future of healthcare. I'm Lalitha Ramamoorthy, the CEO of Hikigai, and I'm thrilled to have you with us today. In today's episode, we're diving into a topic that's not just timely, but also transformational: artificial intelligence in healthcare. From very early diagnosis and personalized medicine to operational efficiency and clinical decision support, AI is shaping and reshaping how we deliver care and how we think about the future of medicine. Today, we have amongst us a phenomenal thought leader, Amy Zolotow, and it's a pleasure to have her on board to give us her great insights about how healthcare is being influenced with AI and how clinical decision support system is actually taking a new face with AI. Welcome, Amy. It's lovely to have you here.
Thank you so much for having me today. I'm so excited to be here. A little bit about myself. I'm Amy Zolotow. I don't like to lead with my title because honestly, what matters more is what I've seen and not really what I've done. I've worked alongside some phenomenal health systems, from large academic medical centers to smaller community physician sites. And I really know that the things that break people are not the ones in the charts. It's not the cardiac arrest. It's not the missed code. It's the grief of a provider sitting in your office, not having the time to spend with her child because she is bombarded with excruciating volumes and not being able to take care of even her family in the midst of overwhelming stress with her job. It's the pediatrician, really holding on to that guilt for rushing through a visit with a family because 3 other families were waiting. These are the moments that I take with me. And when I talk about my background, it all comes down to one word, and that's service. Right now, I'm excited to be working alongside a boutique consulting agency, Prosneos, and I've been also recently appointed a senior fellow with the Belmont Collaborative for Health Systems Innovation, where we're really just not looking at the things that are broken, but we're asking, really what's possible. And we really believe that health systems aren't just these technical infrastructures; they're really these ecosystems, right? And they're built by people. They're shaped by trust, and they're sustained by relationships. So I'm really excited, to be involved with these efforts. Really excited to be with you today.
Thank you so much, Amy. Where do you believe? What do you believe in AI for healthcare? In an essence, if you could tell us what really is the influence of AI in healthcare today?
Mm. It's because we've built a system where compassion's become a luxury, right? I mean, it's not a matter of, us not caring, but it's because the systems don't. And now we're watching over and over again really good people leave the work that once fulfilled them and that they loved, and they're not leaving because of frustration, but it's like a mourning, right? Like they can't do it anymore, they can't take it anymore. There was an article earlier this year from Harvard, and it found that clinicians spend over 60% of their time looking at screens, not patients, right? Like that's an incredible statistic. And when they were asked why they were considering leaving, the top 3 answers, it wasn't about pay, it wasn't about hours, it's not about respect. The answers were, I can't do meaningful work. I am emotionally exhausted. I feel invisible. And that's not burnout. Like we've all been talking about burnout. That's not just burnout. That's systemic psychological injury. So when I say that I believe in AI, it's not just the models, it's not the metrics. I really feel like it can make a profound difference in the lives of the humans taking care of other humans every day.
Interesting. So, how do you see AI transforming the way physicians make their clinical decisions, and what specific tasks do you believe that AI will excel in the forthcoming years?
So I'm going to be blunt. Decision-making in healthcare, it's not rational. I know I might get some side eyes with that comment, but think about it. It's pattern-based, right? It's emotionally primed. It's, shaped by things like experience and culture and sleep deprivation and the fear of being wrong and, overwhelming avalanche of information, right? Like, we train doctors to think in algorithms, but we also throw them into systems that are constantly being interrupted. So they're filled with distraction, and they undercut those algorithms that are ingrained, with just a lot of noise. So clinical decision making, it's a lot about psychology as it is about data. That's one of the most fascinating things I find. I have a human behavior background. I study people, right? I'm a human investigator in that regard in this space. So it's really interesting to kind of tap into that psychological element. So what AI can do, when designed with intention, right? That's the word, intention there. It's offloading that cognition that really breaks under stress. It can track 40, 50 lab values, while the doctor's focused on patient care, right? It can pull patient trajectory from 3 years of just scattered EHR entries while a resident on the side manages a crashing patient, right? It can relentlessly remember what our brains were not really designed to hold, right? So, but it's interesting because when I think through this, there's a twist here. And, if we were basically to design AI to replace thinking, we fail. That's not, going back to that word intention. The intent isn't to replace. And if we've failed. What it's designed to do is really to focus and preserve that presence, right? That human presence, and free up this emotionally intelligent decision making. Those are the things that can really save care. The best AI, it doesn't have to be the smartest, but it really is one that gives human beings the space to be wise, right?
Wonderful. I think that definitely answered my follow-up question that I had of specific tasks that you were talking about, how AI enables or assists in with the humans. So, what are some of the safeguards that you think, or the checks that should be in place to ensure that any AI recommendations is always trustworthy and it's unbiased? This is definitely a great topic I've heard you discuss in many podcasts, and I've seen a lot of your postings too. Would love to hear that from you.
Yeah. No one's going to trust an instrument that they don't understand, right? And especially when their life depends on it. That trust has to be the cornerstone. It has to be at the forefront of everything that we're doing when it comes to the space. And trust is such a human thing. It's a very human thing. And it's been a word that gets thrown around a lot in this space. In healthcare, a lot of people use trust and transparency. They use them in tandem. But trust isn't built through transparency alone. It's really built through this shared sense making, right? It's a matter of connecting with another person to really understand what you're talking about, and then really expand that into the tools that you're using. We don't need explainable AI. We need explainable intent. Who built the tool, right? Who validated it? Who benefits if it works, and what happens if it doesn't? A system really can't answer those questions in plain language. If those questions can't be answered, it really shouldn't be used. Which is why I focus a lot on that social contact piece in trust. When we start treating AI like a product instead of a participant in care, we lose that contact.
Well, this are there any specific situations you may have encountered where, or you may must have come across with, other doctors who've had this, who've used it, where AI has shown a hidden bias, and if so, was that detected and addressed too?
Yeah, it's interesting. We have there are a lot of studies that, focus on racial bias. And it's not just that, but that's also very real and persistent. I can talk through some case studies where the tool was really designed to identify patients at risk for hospital acquired infections. And it performed really well until you started to look closer, and it underflagged elderly women living alone. So why is that? It's because the model was trained on prior interventions, right? So elderly women living alone received fewer interventions due to staffing, due to assumptions about compliance. So the algorithm really interpreted that as lower risk. So that wasn't bias in the code; it was bias in the care history.
Mm,
Bias, AI is not inventing bias, right? It's reflecting it. We're human beings AI is it's innocuous, and it's only when humans come in contact with it where it starts to become biased. It's a reflection of us. So we really have to be mindful when we're using these instruments, using these tools, remembering that it's a reflection of us.
interesting. That's definitely a great example of how you could also show, and I love the way you brought the perspective of how when humans are engaging with AI and how that scene changes. So, from a patient perspective, what would you say there is to reassure to them that AI isn't replacing doctors, but it's rather assisting them? Because that's like the big buzzword, right? That the replacement, as you just spoke about it a few minutes ago. How are we able to, give that confidence or reassurance to patients that this is only going to be a better place for you where AI joins hands with the healthcare system to add more value there?
So I'd say this: they have every right to be afraid. Maybe that's not what you're expecting. Like, they have every right to be afraid because we've replaced presence with process for a
Mm.
long time now, and no one told them we were doing it, right? So the fear isn't irrational; it's earned. It's very much earned. But here, here's what I'd also say. Good doctors are still here. They're still here. And we just need to give them the instruments, the tools, the education, and the time to really show up again. So AI, when it's used right, we talk a lot about that replacing. But when it's used right, it's not replacing anyone. It's really restoring what we've lost. That pause, that presence, human presence, that ability to really listen and engage, as opposed to frantically documenting. We've heard this term, glorified data clerk. John Halamka is he's known for talking about this a lot. But when it's done right, when AI is done right, it really protects that relationship. It doesn't erode it.
That's beautifully summarized my next question that I actually had as a follow up to see how you can make that doctor patient relationship more stronger, where AI is also added as an additional asset or a tool to reduce the drudgery of what you just mentioned, the glorified word of a documentation clerk, and actually add empathy time, more compassion, more time that the eyes of the doctor is moved away from the screen to the patient. Now, thank you so much. That I definitely kind of summarized that very well. But ethically, you're talking about how do we balance, and I think you mentioned the transparency, but we're going to come back to this again, just to dive in. Ethically, how do you balance transparency about AI generated medical advice and with the complexity behind these algorithms?
Mm. So from a human behavior perspective, you don't have to just talk about the tech, right? You have to keep the focus on the impact, because humans, they trust intent, more than the explanation. So, I talk about this a lot when we're talking about AI implementation. People don't need to know the intricacies of the instrument. You don't have to explain to them the algorithm. You do need to highlight the value and what it can do. You need to be able to say things like, I've used this tool to help me see something that I've missed. But I'm also still accountable for what's happening. Like, that sentence in and of itself, it does a lot of the ethically heavy lifting than anything else, because you're highlighting the value, but there's that control element that's also involved, where I still have the reins, right? We're working alongside each other. This is my partner. It's here to help me, but it's also I still have the accountability. I still have the control. So that's really, again, it goes back to that idea of we don't have to necessarily all be engineers. We have to be able to understand the value and be able to translate the value into the impact that the tool has.
Excellent. That's beautifully summarized. I was just going to ask you, how do we not overwhelm the patients, but once the doctor holds hands with the patients and tells them that we are a team working on this together, I think that gives that reassurance to them. Fantastic.
Mm-hmm.
So as AI becomes more commonplace in clinical settings, as we are seeing being talked about so much, what new skills or training should physicians and healthcare professionals acquire to harness the space of AI more effectively in their settings?
Hmm. What I'm going to say might sound very basic, but we don't need better coders. We need better listeners. So the future of care, it's not just a matter of understanding the best technology. It's actually a matter of who understands what to do with uncertainty. And I'm laughing as I say this out loud because uncertainty, that's our world, right? And particularly in healthcare, you never know what's going to happen in any given minute. In roles before, I was lucky if I could actually scratch one thing completely off my list because of all of the ambiguity that you're facing and you're having to pivot. That's what operations, essentially is. So AI is going to raise more questions than it answers. And if we're not teaching clinicians how to sit with that ambiguity, sit in that space and explain it to patients, then we're failing. I had the opportunity to speak at ACHE Congress this year, and Brene Brown was there, and she put together this beautiful presentation. One of her slides, she had stimulus and response, right? And in between that stimulus and response, there's space. Right. And really, it's a matter of doctors, but not just doctors. It's care teams, it's administration, it's every person even just a human being, being able to sit in the middle of that space and pause and reflect is an incredibly powerful skill set. And none of us have time to do it. I feel like there's a premium on that right now, that ability to sit into that space of uncertainty. The best doctors in AI-driven world are not the ones that are going to be incredibly precise, but they're the ones that are really going to be trusted in moments of complexity. So really being able to sit with uncertainty and ambiguity, really sit in that space and be okay, really live in that world. That's the skill set to really watch.
Excellent. And do you see, or the medical schools or the medical training programs integrating AI models into their core curriculum anytime soon, or have you already seen that happening as we go along with the training?
Yes, we're already seeing a lot of movement right now with medical education. I mean, there's no turning back. I mean, this is a movement that we're going to be seeing that's going to become the norm. Um, and it's not a matter of, just teaching AI in medicine. It's really incorporating that interdisciplinary approach. I talk about this a lot, and it's an area that Belmont is known for. I mean, it's that collaborative approach, but it's really looking at that interdisciplinary collaboration. That's where we're really going to move the needle in this space. When we're talking about interdisciplinary approach, we're looking at things also, topics embedded in this curriculum like narrative, like ethics and governance and uncertainty and communication. I mean, we have so many different areas to cover that's already being integrated in medical education, because we have to make sure that we're preparing the clinicians of the future to utilize these tools and to do so together, not feel like they're alone, that they're only looking at one area myopically, that they have other areas of domain expertise that they can draw from and learn from in this space. And really just, it's a matter of preparing them to stand up in systems where the technology just changes so quickly and the trust, changes very slowly. So it's truly a matter of not just focusing on the integration of AI, but also the area that we don't talk enough about is clinician well-being. I mean, our medical students need to know how to take care of themselves because they're entering a world unlike anything else. And I'm a huge supporter, and I get chills when I talk about it because I'm so passionate about it. I've heard horror stories over the years of students just being beaten down by systems. And what we need to be doing is really lifting them up. We can't afford to lose any more people in this space. We need to create an invitation in our medical curriculum to bring more people on board, to make it a safe space, and also say, hey, these are other tools, non-AI, that you can use to take care of yourselves better, because you're not good to anybody else if you can't take care of yourself.
Amy, I think you've definitely summarized all of what we had to get from your conversation and your discussion in a very insightful manner. And I would say, put together, it was a very good balance between AI and EI, which is, the emotional intelligence. And I think that definitely speaks a lot with your background in behavioral sciences. But the last question that I would like to ask you is, two predictions that you would have for AI and the clinical decision support for year 2025. I know we're almost done with the first quarter of the year, but what else is left in store for us?
Oh, so in thinking through this, I feel like the first prediction relates to how people are thinking about AI. So I feel like the instruments are going to get quieter and the questions are going to get louder, right? Like, by the end of 2025, AI ambient listening, we're going to see a lot of that. The listening, the suggesting, the documenting, and the attention at the same time is going to shift to governance and judgment and unintended harm. So the people that really lead in the space, they're going to be the ones to ask the hard questions, right? And they're going to also be asking questions like, did this make things better? For whom? We're going to be educating staff to be able to question AI intelligently. So I think we're going to see a shift, and we're already seeing this every day in the non-clinical space, in everyday interactions. We're questioning ChatGPT right now. Like, we are learning, humans are learning how to ask questions. If I want X, how do I ask the right question? What an incredible skill that we're learning right now. And we're going to see that translate into healthcare. The second prediction I have, um, it pertains to this shift of hierarchy in medicine. So we're entering an era. It's an interesting space. So it's we're entering an environment, an era where really, someone junior, we might have like a junior nurse, for example, question and attending because the AI model flagged something that they missed. So what happens there? A med student is trained in systems thinking, might challenge like a decades old workflow. So the trust isn't coming from the title, right? It's coming from that transparency and collaboration and courage. So that shift is going to create some tension. And I'm really, from a human behavior perspective, I'm really curious about this because healthcare is really like, it's been this system of deference, right? Like to authority and, experience and so forth. But AI doesn't care about precedent, right? It surfaces patterns and, it flags anomalies. And really, it's like handing over the truth to anyone paying attention. So I feel like we're going to see that shift to a shared decision making, hopefully at scale. Because we're going to be pushing each other and questioning each other. It's not going to be a top-down conversation. It's going to be like collaboration. And this is where I tie that back to that interdisciplinary approach. It's not one mindset rules anymore. So, it's the future is not, it's not a matter of it being shaped, just by AI, but about the conversations that are going to be happening. So I'm really curious to see how those evolve by the end of the year.
I love how you've summarized those two wonderful predictions, and I really hope we have less noise there and more noise where there really has to be, as you so rightly said. Thank you once again, Amy, for your very insightful and highly encouraging conversation today about AI in healthcare, and we look forward to having you more often with Hikigai Studios. Thank you once again.
Oh, thank you so much.